A hearty good
Hi.
evening and welcome to today's session. So this session is going to be a very interactive one, and this is Dr. Soumya with us. She'll be talking about the third trimester, what to expect, its do's and don'ts. So stay tuned till the end to know more. Doctor, you have the stage.
Yeah. Hi, everyone. This is Dr. Soumya Raghavan, consultant obstetrician from Apollo Cradle Karapakam. Greetings from Apollo Cradle Karapakam. Third trimester of pregnancy is the last 3 months of pregnancy. So, as we all know, pregnancy is divided into 3 trimesters. First trimester is the first 3 months. Second is from the 14th to the 28th week, and the last trimester is from 28 to 40 weeks. So, a lot of changes take place in this third trimester. A lot of bodily changes, a lot of emotional changes. It is like you feel happy at the same time, you're a little nervous about your delivery process, about the pain. So, a multitude of emotions keep running in your mind. So, let's see what is normal in the third trimester. So, what to expect, how to go about pregnancy with confidence. So, let us see first what changes happen in the mother and what changes happen in the baby. So, first, let us start with the baby. The baby, say from 28 to 40 weeks, is the third trimester, as I've already said. This is the time when the baby has maximum growth. So, baby grows roughly from about 1 kg to about 2.5 to 3 kg. 2.5 to even 3.5 kgs. So this is the period where the baby has maximum growth. Also, baby's organs, all the sense organs start developing, and they are, the baby can actually blink the eyes, it can smile, it can cry, it can suck, it can do everything inside. So baby is actually a miniature of a fully grown baby. So that is the second thing. And third, baby's position. Usually, most of the babies by 28 weeks come to the head down position. So, a few babies who are in the head up position, which we call the breech, they also try to turn around and come to the head down position by about 34 to 36 weeks. Only about 4% of the babies still remain in the head up position. Also, there is something called a transverse lie or an oblique lie where the fetus occupies a horizontal position or a slightly slanting position. These are not the usual things, but you should be aware that baby can occupy any of these positions, though the most common, about 96% of the babies occupy the head down position by then. So which was like at around 28 weeks, about probably 75% of the babies being in the head down position, it becomes to 96% of the babies occupying the head down position. So this is regarding the baby. Whereas coming to the mother, a lot of bodily changes take place in the mother. Uh, for instance, the growing tummy, makes the mother physically feel more tired. Also, there is a change in the back curvature, which we call as lumbar lordosis. Because of that, the mother has a lot of back pain. The pain radiates to the thigh. Sometimes walking becomes difficult. There is also pain in the joints. The joint space, but this is a very common question. They have a lot of pain while walking or turning from the sides or getting up from the sitting up position, or when they're changing any positions for that matter. This is because the joint space, which makes the joint space a little lax. This is to make way for the baby to come out smoothly during delivery. But the flip side of this is this makes the joint space move a little more, and that causes pain and discomfort for the mother. So this is a very common, complaint which the pregnant women face. They keep telling that they have pain in the pubic region, they have pain in the hip joints, they have pain in the back. All this is because of the joint space becoming lax. Apart from that, the growing baby makes the tummy stretch even more, and the skin becomes a little thin. Because of that, they develop stretch marks, and also there is a lot of itching sometimes because of the stretching of the skin. For this, we usually advise the stretch marks cream or any moisturizing cream. Basically, the stretch marks cream is not just to prevent stretch marks, because most of it cannot be prevented. Probably it can be reduced to a certain extent, but it's mainly to make the skin soft and smooth so that they don't have much of itching. So that is about the stretch marks. Apart from that, there is as the baby grows, it exerts pressure on the pelvic region. Thereby, the woman feels a lot of little discomfort there. At the same time, there is an increased urgency to pass urine. Also, sometimes even a slight increase in abdominal pressure, as in a little slight cough or a laugh, can cause the urine to leak. This again is perfectly normal. And also, we have the legs getting swollen up, or you can have varicose veins developing. So, varicose veins again is because varicose veins, by that I mean the veins of the lower legs become very prominent, they become thick, and sometimes they also cause pain. Varicosities can happen in the lower legs, as well as it can also be in the vaginal region. Vaginal, some of them have even vaginal varicosities, which is because the increasing uterus exerts pressure on the great vessel, which is the on the vein, which is the IVC we call it, which receives blood from the deoxidized blood, which is returning from the lower limbs. So that is the legs. So when it obstructs that, the you can develop a prominence of the veins, both in the legs as well as in the vagina. I was also talking about the leg swelling. A little amount of leg swelling is acceptable. This could be because you're standing for long, or you're keeping your legs hanging down for long. All this could lead, because of the gravitational effect, you could have a little swelling of the legs. For this, you do simple home remedies, or simply you can just raise up your legs above the level of the thigh and keep it elevated. That can relieve you of the swelling of the legs. Apart from these change, of course, the breast changes. uh, Overall, there is, the weight gain is there, plus the entire all your tissues enlarge a bit. So also the breast. So the breast tissues undergo enlargement. Also, the areola, that is the black portion around the nipple, will start growing a little more. You have a small, you can call it a little bumpy areas around the areola, which again is normal. And sometimes you can have a sticky liquid coming out of the breast near in the second half of pregnancy. This sticky liquid could be the colostrum, or the first milk for the baby, which is rich in nutrients. So you need not panic if you see some sticky liquid coming out of your breast. So, apart from the bodily changes, which I said, the woman can undergo a lot of emotional changes. She's excited at the same time about pregnancy, but she's always worried about how the pregnancy will go on, and also how the labor will be, whether she'll be able to tolerate pain, whether it is, the fear of pain is more for these people rather than the pain itself. So there will be a lot of emotions, and also whether she can take care of the baby, whether she'll have sufficient breast milk. All those things keep running in her mind. So there is a lot of emotional changes already because of the excitement of pregnancy. Also, the pregnancy hormones can have an effect on the psyche. So it can, sometimes because of the hormones, they can feel a little low or depressed. It is all right. The useful thing when you face such problems is always to consult your gynecologist, or if required, they would even refer you to a counselor. Or it is also good to have a lot of family members and friends around you, so that you can always tell them what you feel, how you feel, and that would be a great help for the pregnant woman. So these are the bodily changes and the mental changes which happen in the pregnant woman. Apart from that, let us now move on to how what do you expect during the pregnancy visits, and how to handle labor. So let us see what we can expect during the doctor's visit. First of all, I would ask all of you to have regular doctor visits. And if they give you a date, please stick to the date and visit the doctor. During all these visits, you will be asked, you first, they will examine you and then probably prescribe some tests and also a scan if required. So let me first tell you how often these visits are going to be. During the first trimester, the visits are once a month, first and the second trimesters. Once we reach 28 weeks, it becomes once in 2 weeks till about 36 weeks. After 36 weeks, it becomes a weekly visit till the date of delivery. So, during each of these visits, what are we going to do? So, the first thing, when you come in, you can always tell the doctor what you feel, or any discomfort or any symptoms you face. You can always tell the doctor, and then probably she would examine you and see whether the baby is growing the right way, also whether your weight gain is adequate, whether there is any swelling of the feet. As I already mentioned, swelling of the feet is okay, a little bit of swelling is acceptable, but this swelling, if it's accompanied with a raise in blood pressure, or if you see we also do a urine test. If the urine test shows any protein in the urine, that all means it is heading towards pregnancy induced hypertension. So during each of these visits, the physical examination and, as I said, the blood test, if required, will be done. So during the physical examination, the doctor is going to check whether the baby is growing well. That is, we see the height of the uterus, whether it is corresponding to the period of pregnancy, and whether the fetal heart is good, and also if there are any other symptoms, as I already mentioned. So all of these symptoms, if there's anything of concern, and then the test, when we see, there is a periodic check of the hemoglobin, a periodic check of the sugars, because diabetes is quite common in Indian women. About almost 30 to 40% of the women have either a pre-diabetic state, or they have gestational diabetes, or they are diabetic during pregnancy. I mean, they are already diabetic and they become pregnant. So check for the blood sugars is very important. Either if they are already diabetic, we go ahead and do the 6-point test of the blood sugars. Or if they're not diabetic, we do a screening test for diabetes in each trimester, and if required, even more often. And also, as I told, we check for the hemoglobin, we check for the sugars, we check for the blood pressure, and also the urine test. So all these tests we do. Besides, there are a few scans which needs to be done. Probably about 3 scans are done during the third trimester, at around 28 weeks, and then around 34 weeks, and then just before the due date. So these scans will also tell us whether the growth is sufficient. Sometimes, if it's a low risk pregnancy, I generally prefer one scan for the growth between about 30 to 32 weeks, and one before the delivery date. So those about the scans. And then again, if there is some high risk pregnancies, we also have to do scans more often. As I said, 3 scans, but sometimes low risk, you can just be with 2 scans, or sometimes even more often if we feel the baby's growth is not sufficient, or there is any other complication developing in pregnancy, then we do scans more often. Along with that, we also do a Doppler if required, that is to see if the blood flow to the baby is all sufficient, and there is no compromise in the placenta or afterbirth. Um, Also, during these visits to the doctor, you can also ask about the delivery plan. You can also ask if you are uh, if there is the option of epidural, which most hospitals provide. The epidural analgesia is given for pain relief basically during labor. So, what does it mean? It is just a catheter which is placed by the anesthetist in the back, in your spine, around the outside portion of the spinal cord. Through that, a catheter will be placed and a medicine will be given through that. When the medicine is given, the labor will still proceed, but you will not feel the pain. So this is a very useful thing for women who are very scared about labor pain, or generally they're very sensitive to pain. This would be a good option. So just be aware of the epidural analgesia. Also discuss with your doctor about it so that you get first-hand information and you're quite confident to go into labor. So actually, there is nothing that you need to be afraid of about labor pain, because the labor pains will be taken care of effectively either with an epidural or also with a gas called Entinox. This again, it is given in a mask. When you inhale the gas, you will feel a lot of relief. But if you want a complete pain, at least the pain will go down by 70%. I wouldn't say 70 to even 80%. I wouldn't say you will have 100% pain relief, but at least about 80% you will have relief with epidural. With Entinox, maybe not that much, but still it would provide. Some people are not very comfortable taking an epidural. So for them, the option of Entinox is there. Also, you should remember to keep someone close to you in your labor room, so that they will give you a lot of emotional support during this labor, when you're going through labor. And also sometimes we encourage them to take the antenatal classes, which will tell in detail about what to expect in pregnancy. Also, the exercises are taught during the antenatal classes. We have a physiotherapist who teach the exercises, the ball exercises, as well as the breathing techniques, the Lama's breathing technique, how to breathe during labor. All this gives a lot of support, confidence, and it gives strength to the pregnant woman to go through labor process. So this is so you can, during each of these visits, you can discuss about the labor plan. You can discuss about the epidural options available and also about what to expect and when to come to the hospital in case of an emergency. So now coming to what you should keep ready before you come into the hospital. Usually, anytime after 37 weeks, we expect the baby to be born. So it is like anytime between 37 to 40 weeks is term. So even 37 completed weeks is taken as term. So anytime after that, you should be aware that you can have pain, you can have bleeding, or even fluid leak, or anytime you don't feel the baby's movements as it used to be, then also you should come to the hospital. So you should keep your bag ready, hospital bag ready. Of course, we are when you're in a big city, it is you get everything either in the hospital or in nearby shops. But still, if you are able to pack a bag and keep it ready, it would be very useful, because even if you get into labor, there is always somebody to carry your things for you to the hospital. So what do you want to keep it in the bag, hospital bag? Probably you can keep your toiletries, and also your nighties. You can keep these feeding nighties ready, and you can have, for the baby side, you can have these big towels which you can keep for wrapping the baby, a few baby clothes which you can probably unisex clothes you can keep. Also, you can the feeding bottles and other things we don't encourage that much, because in case we need it, we can always buy it from the pharmacy here. But otherwise, you can have this palade and all ready in case you're not, a baby doesn't directly feed from you, from your breast. You might need to express, and through a palade or through a spoon, you can just give little to the baby, and slowly the baby will start drinking, and eventually it can even latch on. So for these things, you can keep all that ready. You can also keep your inner garments, or disposable uh, diapers or whatever, both for the baby and the maternity panties for you. All these can be kept, though everything is available in the pharmacy. If you are a person who wants everything to be proper, then probably you can pack your bag and put it there so that anybody can just pick it up and come. So that is about the preparation. So probably you will have to be both physically and mentally prepared for this, hospital visit, and what to expect out of this hospital visit. And also, what are the warning signs which you should, be aware of. So any bleeding during the third trimester is not normal. So this could mean it's either the placenta is low, or the placenta is separating from the uterine surface, or it could be a preterm labor you're getting into. So you should be aware that any bleeding in the third trimester, you will have to look into. So you will have to get yourself checked. Probably a scan or a speculum examination would tell whether things are all right. Also, if there is any fluid leaking from the vagina. So it could be just a watery discharge which is continuously leaking. You might think that you're passing urine, and then again when you come back, your panties might be wet. So you have to be aware that this is not normal. Any leaking, see, you should not mistake the discharge. You can have a little discharge during pregnancy, which is quite common. The white discharge during pregnancy is usually more than in non-pregnant state, but that is normal. So you should be aware and distinguish between what is the normal discharge and this now, which I was telling, is a continuous leak of fluid. That leak of fluid is not normal. See, when you're sitting, you might think it's urine, but even when you're just sitting quietly, you might have your pants wet. So that is not normal. Also, if there is any blood stain discharge, that is again not normal. And labor pains, how would you distinguish between labor pain and Braxton Hicks? Braxton Hicks contractions is something which I have not told you. Braxton Hicks contractions is quite common in the third trimester of pregnancy. By this, what I mean is there is an erratic tightening of the uterus. It doesn't come in regular intervals. It just comes randomly. You feel tight, and then it relaxes by itself, and it is painless. So this is normal process where the uterus is preparing for the delivery. The same contractions, same tightening, later on it becomes more frequent, and when it becomes painful, that you have to take it as labor pain. So how will you distinguish between Braxton Hicks and labor pain? Braxton Hicks, I've already told you, it's an erratic contraction which is not painful. Whereas the labor pain is something which comes from the back to the front, and or it could be simply a lower abdominal pain. Along with that, you will have a tightening of the uterus, and it will come at regular intervals, and you will feel pain. So this is labor pain. So there's a lot of difference between Braxton Hicks, which is painless, and this is painful. So when it comes at frequent intervals, you know that it is labor pain. So you'll have to be aware of labor pain. Also, most importantly, you will have to think about baby's movements. So the well-being of the baby is mainly by assessing the baby's movements. And for that, the mother is the best guide. So why, how, which movement do you take? It's normal, or which is abnormal? See, any movement of the baby, whether it is totally rolling movement, or whether the baby swishes, or if you have a kicking, everything is normal. But the thing is, it should be a regular pattern of movement. Because something which is not the usual, you feel a different kind of movement, then you will have to be a little cautious. Similarly, when the movements are not so strong, you'll have to think over. So how will we know and how many movements do we expect at in an hour or in 2 hours? So the thing is, I don't think all the time you need to be worrying about movements. Generally, through the day, the baby will have a pattern of moving. So if you're like in the initial, say 28 to 34 weeks of the third trimester, I don't think you need to keep account of the baby's movements unless there is a high risk pregnancy. Say you have blood pressure or you have diabetes or something like that, then probably you will have to keep a track on your movements. Otherwise, till 34 or even 36, it is all right. If the baby is moving at regular intervals and you know this is normal, my baby moves after, many of you all will, I've heard many of my patients tell, doctor, just after my food, every time it moves quite vigorously. So that is not, you will know. So even after food, if it doesn't move, yes, there is something abnormal. So then what you do? Don't panic. You just sit quietly or lie down on one side, probably on your left side, and check out how many movements, how many times it moves. See, for checking on the movements, I don't think you should be doing any other activity. You should just lie quietly or sit quietly and observe the movements. If there are 4 to 5 strong movements, then I think you're fine. Say this is about till about 34, 36 weeks. After 36 weeks, probably even the low risk pregnant woman, I think it is good to keep a track of the movements. So probably you can choose a convenient time, say an hour in the morning, an hour in the afternoon, and an hour in the night. A convenient time when you're not doing any other activity, and probably after a meal, you sit down or lie down and just check for the movements. As I said, 4 to 5 strong movements in that 1 hour is good. Your baby is healthy. So, watching on the baby's movements. The fourth point, which I said, is anytime you have less movements or weak movements, either you count for 1 hour or you go to the hospital where a NST, non stress test, will be done, and that will tell us whether the baby is all right. If required, a scan may be repeated at that time to check on the fluid, whether the fluid around the baby is fine. Sometimes, when the fluid around the baby goes down, also, the mother may not be able to feel that many movements. So, this is about the movement. Apart from that, what are the other warning signals? Say, supposing your feet is swollen up, you have a lot of weight gain. In 1 week's time, you gain about 1.5 to 2 kg. Or, as I said, your feet is all swollen up, your face is puffy. All that could mean that you are developing blood pressure. See, blood pressure should be, identified, and the delivery for and the treatment for pregnancy-induced hypertension is only delivery. So, only after the delivery, probably the blood pressure of the mother comes down. So, this is basically, it is something peculiar to pregnancy. So, we'll have to be aware of this condition so that we are, efficiently managed. So, that is the reason why the BP check is being done at every visit to the hospital. So any swelling of the legs, you have to be aware. And for the blood pressure, you know that you have blood pressure means it is always good to follow your medication, and also check your blood pressure frequently. Also run a few tests which would be helpful for the doctor to decide whether the delivery should happen immediately or it can wait for some time. So coming to the next symptom, as in, anytime you have any upper abdominal pain, or it could be it may not be related to pregnancy, but any other conditions which could be associated with pregnancy, any upper abdominal pain. Most of the time upper abdominal pain could mean gastritis, which is quite common in pregnancy. Apart from that, we have certain rare conditions where we have, any gallstones causing trouble, or even rarely we can have the pancreas getting swollen and that causing trouble. So, any abdominal pain, we know how the labor pain feels, but anything, even upper abdominal pain, probably you should visit the doctor. Other things is like, if you have a medical condition, then probably you should be more aware of say, for instance, if you have a cardiac problem, or if you have any other medical issues like asthma, or anything else, that again you should have a specialist in along with your gynecologist. Probably they will work together and figure out how your pregnancy is going to go. Apart from that, I think I also spoke about the labor process and what you should be expecting during labor. Say, basically, it's only about the pain management. So, in labor, you have different stages of labor, which I don't want to go through now. So, it's sufficient if you have the confidence that the pain can be managed, and uh, with your Lamaze exercises, with your probably the pregnancy exercises, all this would help you to build up your stamina, and along with the epidural, it would give you a good pain relief, and probably you would have a safe and normal vaginal delivery also. So these are the things you expect in the third trimester, and what you should know about the labor process. Now, what you should avoid in pregnancy. Basically, I would say there's nothing big that you should be worried about in pregnancy, except that you should be very careful about not missing your doctor visits. You should make sure that you eat a balanced diet, as in with lot of proteins, lentils, lot of fruits, a lot of vegetables, and probably 2 glasses of milk or 2 cups of curd. All these are important. Also, carbohydrates to a certain extent, because I don't think you should overload yourself with carbohydrates, because the weight gain is another problem, and how to lose weight after delivery is a problem. So, you eat a balanced diet. And regarding the beverages, probably coffee is okay, 1 or 2 cups, because people say don't drink too much of caffeine. It's not that you're going to be addicted to caffeine. Then yes, you should not drink. But 1 or 2 cups of caffeine is not a problem. You should also drink a lot of water, probably to hydrate yourself. Also, because UTI is quite common in pregnancy, so it is always better you flush out your kidneys with by drinking a lot of water. Again, one a useful tip is, please don't drink water late in the evenings or in the nights, not too much, because that would make you get up in the night so many times that your sleep becomes totally disturbed. As it is, you will be waking up once or twice in the night to empty your bladder, to use the restroom. But when you drink more water during the late evenings, that would trouble you more, and totally your sleep would be disturbed. So drink a lot of water, a lot of fruits, vegetables, as I said. Avoid street food, avoid junk food, avoid processed food, avoid too much of salty food. Um, and probably anything which is raw, be it fruits, or wash the fruits, or even vegetables, it's preferable to boil and eat. Also, the meat and all, of course, here we always cook and eat, so that is fine. So you should be careful about all these things. um, Apart from that, I think that is it. Don'ts, as in, yeah, exercises, very important. You should enroll yourself in antenatal classes, and even the physiotherapy classes, where they will teach about the antenatal exercise. You can do yoga, you can do walking at least about 30 minutes, both in the morning and the night. Also, you can breathing exercises, as I said. And probably, yes, light weights is acceptable, but don't do heavy workouts, because that might sometimes induce preterm labor. Again, a word of caution about exercise: always consult your gynecologist before starting on exercises, because you have certain conditions in which we would advise not to exercise. For example, say, supposing you have frequent miscarriages, or you have early trimester bleeds, that is early first trimester bleeds, or you have a placenta which is low lying, or you have a previous history of preterm labor. All these conditions, it's preferable to ask your doctor and go ahead with the exercises. I think with this, I've covered what to expect in the third trimester, and I hope I've given to a fair extent a little confidence in you so that you can get through pregnancy and labor, uh, with more confidence. So with this, probably we will end this session, wishing you all a very joyous and happy pregnancy, safe delivery, and a joyous motherhood.